So you have a patient that's presenting with bacterial meningitis symptoms, and you want to conduct a search inside of UpToDate to kind of figure out what general approach you should take with them. So I can start typing in bacterial meningitis within the search bar, and you can see that I automatically have predictive text below to help me get to my information a little bit more quickly. In addition to that, again, you're always going to have this drop-down box to help prioritize your information out. By selecting adult and pediatric content will help prioritize that information out, depending on what patient you're dealing with. So I'm going to go ahead and select bacterial meningitis from the drop-down menu. And I can see that there's a couple different topics that's obviously prioritized in relevance to my particular search terms. If I'm looking for a quick answer on the general approach, I can find that a couple topic headings down, I can see initial therapy and prognosis of bacterial meningitis in adults. In addition to that, I know that I can find my quick answers within the summary and recommendations section over here in the outline bar. By scrolling down, I can easily see that general approach is actually one of the headings within the summary and recommendations section. I can easily click on that hyperlink and it'll take me directly to my quick answers, which are going to include my treatment and screening recommendations for this particular case scenario. You can obviously see that there are several bulleted items here which will help guide you to making the correct decision. However, you can also see a couple bullets down that we recommend the antibiotic therapy be initiated immediately after the performance of the lumbar puncture, or if a computed tomography scan is to be performed before LP, immediately after blood cultures are obtained. The reason why this one's significant is that we actually have, this particular recommendation is graded. So within each topic review, whenever you're looking at your case study, if you're interested to know the strength of the recommendation as well as the quality of evidence behind this particular recommendation, you can simply click on this grade 1B, and it's going to bring up those two components, which are represented by the number and the letter. So you'll be presented with your guide below to help you make your actual clinical decision as far as the treatment and screening recommendation. But also at the top, you'll get the meat and potatoes of this particular recommendation, which says it's a strong recommendation and it applies to most patients. That's really the information that you're going to be looking for, especially since it is graded from our specific experts. In addition to, if you're working with a patient and you're wanting to find different drugs and information that may also be included in here, you can simply use the outline bar to help you get to that information over on the left-hand side. By scrolling down within this particular section, you can also see there are different case scenarios that you may be faced with this particular patient. If there's no known immunodeficiency, if there's impaired cell-mediated immunity, healthcare-associated meningitis, and so forth. Within this, if you're looking for specific drugs, you can easily click to the drug that you may need to read more information about because it is relevant to this particular patient. This is going to open up the new browser window for you, and it will include the actual drug information from LexiComp. In addition to this particular patient scenario, if you're concerned with who's contributing to this content, if you want to make sure that this is the trusted information that you're reading, especially while working with your patient, at the very top of each topic review, we include all the author and editor information. By clicking on any one of their names and/or titles, it'll actually bring up the information about these particular experts. Two requirements is you'll find that they both have an academic affiliation as well as being clinically active. So again, just making sure that it's coming from those trusted experts. So in addition to this particular scenario, if you wanted to look at some of the images that may be associated with this particular topic, say we want to look at bacterial meningitis adult antibiotic dosing. If we wanted to move forward with that, that's a particular table that's actually within this topic review and right at your fingertips. This is going to, again, help you guide to make sure that you're giving them the correct dosing and so forth, depending on, obviously, what agent you actually want to use. This can be printed and emailed, of course, since it's one of our images, as well as exported into PowerPoint if you needed to utilize it that way. In addition to that, you're also going to find a list of all of the references down at the very bottom. You can simply use the outline by clicking all the references to see where this information is coming from. It's also going to be hyperlinked throughout the text. So anytime you see a hyperlink number, you can simply click on that and it'll take you directly to the Medline abstract, just as these references do below. If you're interested in diving in and conducting a little bit more research beyond getting your quick answer to your clinical question for this case scenario, you can easily link out for the full text of the article here or link out directly to PubMed as well. In addition to all of the reference information, to dive in and really conduct more research for this particular patient that may be presenting with bacterial meningitis, if you get inside of the topic review, anytime you see an underlined hyperlink that's in parentheses as well as quotation marks, that's going to link you out to a totally different topic review where it may be more relevant to the information you need to access. So I wanted to make sure that all of the links that are within each topic review, that you feel comfortable in clicking on any one of those and making sure that you're getting the information that you need while working with this particular patient. In addition to just the actual clinical content, if you really want to provide relevant information and trusted information to your patient as well, up in the top right-hand corner, you can actually see there's a patient link. By clicking on this, it's actually going to be information for the patient that's concordant with the information you're reading right now. So it is going to be on their reading level. You can easily see there's links provided in both the basics and the beyond the basics information. This information can be clicked on and linked out to the content that can actually be emailed or printed for this particular patient. So you can easily see those topic tools in the top right-hand corner to email or print for your specific patient. Going back to our specific topic review, I want to make sure that you also have the ability to email or print this information out for later. So if you're working with that specific patient, you wanted to print this information out for their chart or for your files, you can easily hit the print button and choose what you want to print. In the top right-hand corner, you can easily deselect any of the references, graphics, or text and really just focus on the information that you want printed for your files. In addition to that, you can also email this information. If you wanted to email this information to a colleague, if you're looking up information for them for this particular patient, or email it to your personal email address to review later, you can simply click on the email button in the top right-hand corner and easily put in a valid email address in the bottom left-hand corner, and it'll send out this entire topic review within the body of the email. So I wanted to make sure that we covered that whenever you're working with your specific patients. That is basically everything that I could show you to obviously help with this particular case scenario, and hopefully it'll help you guide your patients if you are faced with bacterial meningitis.